This is a brief video on how to do an abdominal CT scan. An abdominal CT scan makes detailed pictures of the structures inside our abdomen very quickly. Therefore, this test may be used when we look for a cause of an abdominal pain or swelling, a hernia, a cause of a fever, masses and tumors including cancer, infections or injuries, kidney stones, appendicitis, amongst others. This imaging method is rather easy to do, but it has its steps that are very important to do properly. There is a phase where we prep the patient, and it consists of various indications. First, the patient must be on an empty stomach, preferably ask them not to eat anything 6 to 8 hours prior to the test. Second, we ask the patient to fill out a questionnaire where he or she consents to the procedure and answers a few questions informing the technician of any previous allergic reactions and basic information to later identify the patient. Third, we inform the patient what the CT scan procedure consists of, which is administering a dye also known as a contrast, intravenous to dye the arteries, and orally where he or she will be drinking a solution to dye the stomach and intestines. It is important to mention that he or she may feel a burning sensation, a metallic taste in their mouth, and or hot flashes due to the contrast. After, we proceed to place the intravenous entrance for the dye and ask the patient to slowly drink the solution, allowing the contrast to highlight the structures properly. Here, we can mix the dye in flavored water for the patient's benefit. After drinking about 4 to 8 cups of contrast mixed with water, we then proceed to the next phase. Here, we ask the patient to remove all clothing except his or her underwear and explain what will take place once we place the patient on the table of the CT scanner. Next, you place the patient lying down facing up with his or her hands above their head to avoid artifacts. We then charge the contrast injector, which will be slowly administering the contrast intravenous. After this is done, he or she will be there for about 30 minutes tops, where the machine's X-ray beam will rotate around his or her body without stopping, generating images or slices of images that will later appear on a monitor, where they can be reconstructed in a sagittal, axial, or coronal view. It is important to ask the patient to remain still in order to ensure good quality images. Sometimes you will need to ask the patient to hold their breath in for a short period of time. Once the procedure comes to an end, we instruct the patient to drink plenty of fluids to help eliminate the contrast of the body. Also, he or she will be starving, so inform them they can now eat. The patient will then wait for his or her results. This concludes the video, so now you know how to do an abdominal CT scan. Thank you. Bye.